Hi, this is Dr. Jim Anderson from Anderson Podiatry Center, here to talk to you about how much you can expect to be laid up with a bunion surgery. And I think that's very important because surgery, the idea scares people, and then when they think about it, it's like, oh my gosh, how much am I going to be laid up? And I think that's a very, very important consideration. And I like to think by the end of the video that you're going to see that maybe the layup isn't quite as great as you originally had thought or had heard. Because I hear patients come in quite frequently with a very big misconception of how much they're laid up. And this is what I personally hear is, oh, I've heard that you have to be 6 weeks off weight bearing, maybe you have to be in a cast, can't bear weight for 6 weeks. And I'm just trying to tell you, in very few cases is that ever the case. Maybe just 5% of the time do we see patients that have a bunion that is that significant that we'd have to do that. So I better back up for just a minute and explain what is a bunion. And I've got a little skeleton here just to show you. And in a normal foot, and the alignment of these 5 metatarsal bones, we call them, is fine. This foot looks fine. But when you develop a bunion, that would be a bump by the big toe joint right here. And it's not that you've got a lot of extra calcium or bone buildup here, but rather this first metatarsal swings away from all these other metatarsals. So this bone swings out away from bone number 2. Normally the angle between bone 1 and 2, first metatarsal, second metatarsal, is like 0 to 8 degrees. And most of the time when people come in, the angle between these 2 bones is going to be higher. It's not going to be 0 to 8. It's going to be maybe like 11, 12, maybe even up to 16 degrees. The higher the angle gets, the more severe the bunion, the bigger the bump, and the more layup might be required for surgery. But I want you to know from our experience, or mine of over 30 years, that we find that probably 95% of the time when we correct the bunion, the correction is done out by the joint. Not here, but up here. And to correct the deformity, we don't just go in and shave off the bump. That's not enough. That was done years ago, and that's why there were a lot of patients that didn't have good results from their bunion surgery. Rather than do that, we not only shave off the bump, but we shift the bone over so that bone 1 and 2 are under 8 degrees, so the 2 bones are more parallel. How do you do it? You can do it by making an incision through the bone here or here. If you're working back here, that's reserved for really severe bunions, and yeah, you may have to be off weight bearing for 4 weeks, 6 weeks. But up here, no, you can walk within a few days. And again, 95% of the time we shift the bone in this area. And when we do that, you can expect to be in a shoe like this. This is just a surgical shoe. It's for a fairly big foot, but that's what you would be in. And so when we do surgeries, I myself, if you do 1 foot, I usually have you keep weight off of it for maybe just 4 or 5 days, just to baby it a bit. But after that, you're walking in this. And you're in this for usually around 3 weeks if you do 1 foot. And yes, we do both feet. If you decide you want to do both feet, then you wear both of these, and it might be a little bit closer to 4 weeks. But from that point, then you go into a lace-up shoe, like a tennis shoe, and then maybe about 6 to 8 weeks out, you're going to be able to go back to sometimes some of the dressier shoes. So that's basically the layup that I want you to understand with bunion surgery. So this is what you're walking around in. It's not the most beautiful design, but it's what you would need to wear for roughly 3 to 4 weeks. So hopefully that helps you understand a little bit more about the recovery. And usually maybe about the first 3 or 4 days, we want to have that foot elevated or those feet for about 45 minutes an hour, and then after that you gradually transition to more and more activity. So hopefully that helps you understand a little bit more about your bunion and what would be necessary in terms of recovery. And I would like you to please visit our website at andersonpodiatrycenter.com for further information, or please come in and give us a call and we can answer your questions then. Thank you.